people are familiar with mosquitoes as a nuisance. They bite and it irritates and itches. But particularly in tropical countries, mosquitoes are known for transmitting numerous diseases, perhaps the most famous being malaria, but there are quite a few others. This affects not just a few thousand people, but millions of people every year and leads to mortality, particularly related to malaria in Africa, with children under 5 being the most vulnerable. Climate change is clearly having an impact on the ability of the mosquitoes that transmit malaria and other diseases to thrive and do better in wetter conditions. There are parts of Africa where, either due to elevation or temperature being a bit too low and humidity being a bit too low, the mosquito vectors wouldn't do as well. But now with climate change and rising temperatures, higher elevations in many parts of Africa are now susceptible because the vectors are able to do well in those climate zones. Climate change is impacting malaria cases and spreading malaria where it previously didn't exist. You have to prepare the whole health system, from lab people to health facility workers who are seeing the cases firsthand. Without this capacity, it becomes extremely difficult to adjust to any changes that malaria disease transmission will have. Supporting these efforts is what really will make a difference.
Les plus grands défis pour la lutte contre le paludisme à Madagascar, c'est vraiment l'insuffisance des ressources. Insuffisance en ressources humaines d'abord, en santé, l'insuffisance des infrastructures sanitaires et également vraiment la distance entre les communautés, distance des centres de santé, des centres de traitement, qui rend vraiment l'accès aux soins extrêmement difficile pour les populations rurales. Je pense qu'au cours des 10 dernières années, une des adaptations majeures que le pays a adoptées, c'est l'équipement et la formation des agents communautaires, des volontaires communautaires, à prendre en charge, détecter et traiter le paludisme dans les villages les plus reculés. Nous sommes même allés jusqu'à équiper ces agents de santé communautaires. C'est un outil informatique, un outil digital. À partir de leur smartphone, ils peuvent maintenant suivre les soins des enfants et suivre un algorithme très précis pour réduire les erreurs dans la prise en charge des enfants malades, y compris les enfants malades du paludisme.
We can support health systems to identify early new cases of vector-borne diseases and control them. That's really where a resilient health system comes in. MSH is already supporting our partners and governments at the local level, at the district level, at the national level to plan for strong surveillance, early monitoring, linking patients to treatment, diagnosing new cases, supporting supply chain, all of those elements of the health system that are critical for responding to vector-borne and specifically mosquito-borne diseases. However, as we're seeing, climate change is a challenge that is in every country in the world. It's critical now in this moment for governments to be planning accordingly. We need to be coordinating at the national, the regional, and the global level to prepare together, because we know clearly from COVID that diseases don't stay within borders. They move, and so vectors are doing the same with climate change. As we think about working with our partners to strengthen critical health system functions, we need to be supporting our partners to think about climate change adaptation and how you integrate that into your health strategies and planning, so that you are not always responding, but you're actually anticipating and predicting and supporting your local healthcare workers, your community-based healthcare workers, to also be prepared for tracking, to looking for those things and planning ahead so that we have the resources that we need to support patients when they get sick and also to prevent future cases.